On behalf of the Commissioner of Health, Mary O'Dowd, it is my pleasure to be with you this morning to help kick off the inaugural Healthcare Industry Week. I commend the New Jersey Healthcare Talent Network, Rutgers University School of Management and Labor Relations, our sister agency, the New Jersey Department of Labor and Workforce Development, and everyone else who worked so hard on bringing us together this morning to highlight opportunities available in New Jersey's growing healthcare sector. I am sure you're aware this week's activities, Healthcare Industry Week, will continue to grow along with opportunities that are available with the industry. We are all aware with the expanding coverage, whether through New Jersey's Medicaid expansion or the Affordable Care Act individual mandate, the demand for healthcare services will increase. This demand will strain the capacity of those parts of the healthcare system that are already under pressure. Particular challenges will arise in the areas of primary care, culturally competent and linguistically accessible care, and highly specialized care. In fact, it is estimated by the year 2020, New Jersey may face a shortage of over 3,000 physicians, of which more than 1,000 will be primary care doctors. And by 2030, New Jersey expects a shortage of over 20,000 registered professional nurses. In recognition of the essential role that New Jersey's teaching hospitals play in the healthcare workforce development, Governor Christie has increased graduate medical education funding by $10 million, bringing total state funding to $100 million. Graduate medical education payments help compensate 40 teaching hospitals for costs directly related to physician education, such as salaries, benefits, faculties, and administrative costs. Through this funding, the state is making direct investment into the training of medical residents. The Department of Health understands that the state's healthcare landscape is changing rapidly, and as healthcare changes, so must the skills and knowledge of our healthcare workforce change. Registered nurses will be needed in new and expanded roles in primary, chronic, and preventive care across the entire continuum of healthcare. Nurses are highly educated to meet the complex demands of healthcare and represent an area of growth opportunity in New Jersey. In addition, advanced practice nurses can help fill the physician shortage gap and improve access and quality as primary care providers at a reduced cost. The Department of Health is represented on the New Jersey Action Coalition, which is focused on ensuring that there are nurses for New Jersey citizens. Formed in 2010, the coalition is addressing the recommendations of the landmark Institute of Medicine report, The Future of Nursing, Leading Change, Advancing Health. Currently, the coalition is concentrating its efforts on ensuring that nurses work to the full extent of their education and licensure, and on increasing the proportion of baccalaureate-prepared registered nurses to 80% by the year 2020. The Department of Health is intensely aware of the urgency of expanding our healthcare workforce. Moreover, we recognize there will be fundamental changes in how healthcare is delivered. Healthcare services will move from hospital-based to community-based care. Information technology will become an important component of the delivery system. There will be significant changes in reimbursement with financial incentives tied to quality outcomes. And we will be serving an increasing population with greater healthcare needs, while large numbers of our current healthcare workers will be retiring. It is important to note the healthcare workforce needs to expand beyond physicians and nurses. We will need greater numbers within the other healthcare professions, and we will need to augment their services with paraprofessionals, technicians, and unlicensed workers. Expanding healthcare capacity is a long-term Department of Health endeavor. We are working with our partners to expand provider capacity through regional planning efforts in Trenton, Newark, and Camden to leverage limited resources in a rational way that addresses community needs. We are working with our partners to expand provider capacity through developing health information exchanges, through supporting community health workers, and through initiatives for innovative payment and delivery models associated with telehealth for treating people with chronic illnesses. In addition, the department administers programs which are designed to increase the availability of primary care clinicians practicing in underserved areas through the use of incentives such as loan repayment and waiver of foreign physician home rule requirements. Also, the department is a member of the New Jersey Healthcare Workforce Council, which works in close contact with organizations like the Healthcare Talent Network. The network has, of course, been a key player in making Healthcare Industry Week a reality. The Workforce Council is represented by many of the people and organizations who are with us this morning: healthcare employers, educators, workforce experts, organized labor, and professional organizations, all of whom are working together to create a healthcare workforce that can support our state system and its residents. The Workforce Council has been valuable in understanding that recommendations must be made within the context of New Jersey's healthcare needs and should be used to inform the educational programs. Specifically, the Council provides policy recommendations to improve the healthcare workforce. It reviews and assesses workforce models to improve healthcare delivery and access to care. It is identifying ways to increase access to healthcare careers and to equip the current healthcare workforce with the skills needed to be successful. And it determines the most successful strategies to create a viable pipeline of educated healthcare workers who are trained at levels required by the healthcare employers. The Council recently released a set of recommendations that include ensuring that healthcare education and training investments are based on the needs of employers. The recommendations include ensuring that students and job seekers have access to information on healthcare careers, reviewing licensing and certification processes to eliminate barriers and streamline the system so that qualified candidates can more quickly enter the healthcare workforce, and creating a responsive training and education system to build the current and future capacity of the workforce. In closing, I would like to thank the New Jersey Healthcare Talent Network, Rutgers University, the Department of Labor, and of course, all of the vendors, professionals, employers, and students who will make the inaugural Healthcare Industry Week a success. Thank you.